Hey, thanks for making it to Veterans Info Tap. I'm glad you made it. Look, I wanted to talk to you about VA's fourth mission and a headline that I saw and also comments from many of you regarding this specific topic. Now, I didn't do a lot of digging. All I did was I did a little bit of searching to find an article to actually relay to you. So that's where we're at. I'm going to hit the headline here, and then I'm going to read you VA's fourth mission as it kind of ties in, and then we'll jump into the article. So the headline is VA's role in migrant medical care draws scrutiny from advocates as border crisis intensifies. Let's say it again. VA's role in migrant medical care draws scrutiny from advocates as border crisis intensifies. Hit the thumbs up, subscribe, share with a friend. All of that is vitally important. The two asks that I have of you in order to make this reach as big as possible and get this information into more veterans' hands and spouses and dependents, anybody who is affected within the veteran sphere, right? The two asks are hit that thumbs up. Two is let the video play, because the longer it plays, the longer you let it play, the more YouTube goes, okay, we should send this out and put it in front of more veterans. Otherwise, they just kind of stifle it. So just so you're aware. All right, so I appreciate the support. The VA's fourth mission, I'm going to read that to you here. This is directly from the VA's website. Of course, it's buried 1,000 pages down and what have you. VA's fourth mission is to improve the nation's preparedness for response to war, terrorism, national emergencies, and national disasters. Even Stan's got something to say. Stan's the rooster. By developing plans and taking actions to ensure continued service to veterans, as well as to support national, state, and local emergency management, public health, safety, and it goes on and on. Anyway, the bottom line is that that national emergencies piece is really what I'm kind of probably pointing to the most. I mean, that's the only thing that I could see of which you can essentially invoke the fourth mission of the VA and say, hey, look, we have a crisis. This is an emergency that we need to take care of. So now going back to the article piece here, VA's role in migrant medical care draws scrutiny from advocates as border crisis intensified. The subheadline, Concerned Veterans for America said lawmakers should look into the arrangement. So with that, if you want to support the channel in other ways, you can by becoming a member, and I really appreciate that. That does help out the channel immensely, and I appreciate each and every one of you members. My goal is to respond. I'm not sure how long. Sometimes it might take a week or more to respond, but to respond to all comments by the members. So it helps me to find you in the comment section when you become a member and you join. So anyway, jump back into the article here. A long-standing arrangement between the Department of Veterans Affairs and Immigration and Customs Enforcement, ICE, to process claims for migrant medical care is drawing scrutiny from veterans advocates. So first of all, were you even aware of A, the fourth mission of the VA, and B, that this is going on, right? So you wonder why the VA gets so thin sometimes. So who are concerned that it could affect the agency's mission for caring for veterans, which is the cornerstone of the VA, right? I mean, that is the main thing. Amid an ongoing border crisis and existing complaints about the care delivered to veterans, I'd like to understand why the VA is involved. Russ Durstein, Executive Director of Concerned Veterans for America and a veteran of the United States Air Force, told Fox News Digital. When an illegal immigrant under ICE detention requires health care, they are typically treated on site by medical professionals. However, if specialist or emergency care is required, they may be transported to an independent private doctor. In such cases, ICE contracts with the VA's Financial Services Center to process reimbursements to those providers. According to a report in July, ICE has hundreds of letters of understanding in which ICE's health Services Corps will reimburse providers at Medicare rates. That uses the VA's healthcare claims processing system, a portal that allows providers to submit and view claims and access other resources. The arrangement long predates the Biden administration. It was outlined in a 2020 memo during the Trump administration, and the VA told Fox News Digital that it has an interagency agreement with the IHSC since 2002. So that's what? Almost 14 years ago. To provide processing. The agency stressed that it is not the VA that either provides health care or pays for it. VA does not provide or fund any health care services to individuals detained in ICE custody. At no time are any VA healthcare professionals or VA funds used for this purpose. VA Press Secretary Terrence Hayes told Fox News Digital, IHSC provides and pays for all healthcare services for individuals detained in its custody. Hayes said the FSC, which is part of the VA's Office of Management, is a franchise fund organization that offers medical claims processing services to VA and other government agencies. Under the agreement with IHSC, ICE pays fees for the claims processing services rendered and covers disbursements made to pay for claims. IHSC is solely responsible for the authorization of health care services and obtaining the providers to deliver the health care, he said. In a statement, ICE also said that the VA does not provide or fund any services to ICE detainees, and instead providing funding for VA FSC for reimbursements, and that IHSC executed an operating budget of nearly $352 million on the spectrum of health care services to people in ICE custody since fiscal year 2023. But the arrangement has surprised some advocates for veterans as well as ICE and Border Patrol agents. Fox News Digital spoke to who are themselves veterans. VA officials were also asked about the arrangement at a Senate hearing last month by Senator Jerry Moran and said that they were not aware of it. Darren Selnick, who served as Veterans Affairs Advisor on the Domestic Policy Council during the Trump administration and also as a senior advisor to the VA Secretary, said the arrangement was also a surprise to him and others he knew who served during the administration. He believes it would have been stopped if it was more widely known among officials. In my position, we would have stopped this because if the VA had an extra ability to do this, then they should have been doing it for the veterans and not for another agency, he said. Durstein of Concerned Veterans of America, or for America, said he would like to see Veterans Affairs committees in Congress take a deeper look into the VA's role. That is the solution we need to have, he said. It also comes amid a historic crisis at the border, which saw more than 2.4 million, with an M, million migrants encounters by 2.4 million migrant encounters by authorities at the southern border. Although the Biden administration has moved away from detaining immigrants, including family units, but it also comes amid ongoing tensions between veteran advocates and the VA over the use of community care, with the VA indicating they want to encourage the use of VA facilities rather than the use of independent providers and reimbursement. Okay, there's a little different kind of sideways nugget here. The VA, right? So the VA is concerned about the use of community care, with the VA indicating they want to encourage the use of VA facilities rather than the use of independent providers and reimbursement. And you might ask why? Well, look, it's self-preservation, right? If people stop going to the VA, well, then why does the VA need to exist? And then therefore, there goes your job, right? So or your legacy, or a combination of that. So a little important side kind of piece there. And, if you like the VA and you like the ability to have your own healthcare system, then make sure you use it. If you don't like it, then continue not using it, right? And then one way or the other, enough people are going to do one thing or the other in order to make a change, right? So moving on, a video from an August employee town hall provided to Fox showed the Undersecretary of Veterans Affairs for Health, Sharif Ellenhall, telling employees that the goal is to reduce our reliance on community care by maximizing care at VA facilities. He told employees to press the easy button, less with community care. Interesting. That's a horrible quote. So, we'll read the quote again. Reduce our reliance on community care. Press the easy button, less with community care. All right, moving on. We should be relying on ourselves first and foremost, more than anybody else, he said, adding that unless we maximize the number of veterans we see while also preventing burnout to the extent we cannot meet the mark for what veterans deserve. And so, look, both sides of the fence, right? So one side is, look, my job is, if I'm wearing that hat, right? My job is to provide care for veterans, and I'm benchmarked on veterans coming in and going out, right? So I want to keep those numbers moving upward, ideally, and show that I am doing a good job. Keep all of my employees employed and keep the money coming. Or the other way is, that you don't want the VA to see you, right? Because you don't like the care that you're getting there. So then you are looking to go elsewhere. And now, all of a sudden, you're getting roadblocks thrown up in front of you, which is not good. So anyway, moving on. The VA has pushed back on claims that it is not providing adequate health care, pointing to statistics showing it provided the most health care appointments to veterans in VA history and a trust score reach of 91%. Additionally, there were more than 44 million appointments via community care, the most in the agency's history. It has also highlighted high ratings of VA healthcare facilities outpacing non-VA facilities and a review of studies that suggest VA care is as good as or better than non-VA hospitals. But the VA has also been struggling with burnout and broader concerns about staffing shortages and backlogs in processing claims. Durstein said the VA ICE arrangement would probably be less of an issue if the VA was not letting veterans down. That is the real issue. Veterans are not getting health care they deserve through community care and being blocked every step of the way. There is no excuse for it, he said. Selnick said there was a history of a backlog of medical claims which has resulted in veterans getting bills they shouldn't be getting and having dissatisfied community care providers who are getting paid in a timely manner, who are not getting paid in a timely manner. So the community care providers are like, well, wait a minute. I've been burned 1, 2, 3, 4 times. I'm kind of getting burned out of working with the VA, and my patience is running thin because I'm not getting paid from the VA. Moving on. So when you're talking about healthcare, and you should be simply talking about supporting the VA mission for veterans' health, he said. A Border Patrol agent who spoke to Fox said that they had personally received good community care, but other veterans they knew were struggling to access it, while illegal immigrants weren't having that problem. They get pretty much not what they want, but pretty much what they need. Whether it's a specialist, they get it, the agent said. The agent also highlighted low-income veterans who were facing additional struggles and were here helping everybody else in our own backyard. An ICE agent who is also a veteran told Fox News Digital they had repeatedly struggled to access community care for certain healthcare services, including for services like neurology, and were frustrated that illegal immigrants were able to be seen in the community by providers. We served in the military in this country, and we have these benefits to use in the VA. And I pay an exorbitant amount of taxes to this country, and I can't even get seen for basic needs, the agent said. But illegals can. They can literally cross the border with all these pre-existing medical injuries or illnesses or whatever they have going on, and they literally walk right into a primary care doctor or specialty care doctor and get whatever services they need. Period. That was the end of the Border Patrol's quotation there. So, I get it, right? Veterans are not having the best experiences when it comes to getting health care. There's a bunch of hurdles in the way, and then you hear that the VA has some sort of an agreement with immigration, and they're helping to facilitate invoices and paying bills for illegal immigrants who are getting all the care that they need right when they need it. And that's a very frustrating situation. So, it's something. Look, the bottom line is that the VA needs to be better. I think that there needs to be some more checks and balances at the border, obviously. So with that, we'll go ahead and conclude it there. Wanted to bring you into the loop and read to you something that I was able to find. I hope you have a great one. And remember, if we don't take care of each other, something went wrong.